Will everybody sign on to it? Probably not. Will everybody need it? Probably not, but it needs to be part of the conversation.
When patients come into your office, what are they coming in with the most?
Mood, irritability, rage, where they're just upset with people and they don't understand why.
I call them my murderous days, pre-period. Welcome back to part 2 of my wonderful conversation with Dr. Jila Senemar. Let's kind of bring it into something a bit bigger. Surely my 40s can't only be about hormones. What else? Like, is there more to life, more that we can think about in our life to kind of coping with this phase?
So the bigger question here in your 40s is, how can I optimize myself, right? To get me into the 50s and 60s at my best. And so this is the window of opportunity where you can move more, build that darn muscle. It's going to keep you moving. It's going to keep you vital and active, where you can sit on the floor and get up from the floor. Okay. You're going to be functional. The goal is for all of us. Honestly, we don't want to be a burden on our children, right? And I don't want to end up in a nursing home. So how do I avoid all of that? It's by building this functionality in earlier. So in your 40s, you need to be building that muscle, because that then will help maintain your strong bones. So now you're avoiding sarcopenia, which is loss of muscle. You're avoiding osteopenia and osteoporosis. So we're doing great there. The next part of it is nutrition. Okay. We talk about this all the time, yet what does that look like? It's really farm to table, making sure you're getting everything. I don't like diets where you eliminate certain things. Maybe if there's a sensitivity or an allergy, that's a different conversation. But in general, you want to make sure you're getting your protein. You want to make sure you're getting fiber. You want to make sure green leafy vegetables, fruits, and just kind of have a mixture of everything, because that's sustainable. If I put you on a specific diet for a specific reason, will it work? Yes. Is it sustainable? No. So you want to be building things that you're going to be able to implement every single day. Then the biggest one of all the lifestyle is really sleep.
I was going to say, we've talked a bit about this, but
sleep is at the top. If your sleep is not optimized 7 to 9 hours with good, deep REM sleep, where you feel rested the next day, because sleep is where the cells regenerate and recover. So you need to give your body that break every night to do what it needs to do to function for you better the next day. After sleep is your nutrition that we spoke about, making sure you hit all the macros, you're getting the protein, you're getting the fiber, and as well as just, removing ultra processed foods, removing alcohol. That's another one that we don't talk about enough, but it does impact everything. It can even impact your sleep in perimenopause, and you're not going to get a good night's sleep. The third, part of that is movement. What are you doing to move? You need to be moving every day. There needs to be some component. I think what I tell my patients is do things that you enjoy doing. Because if you don't like doing it, you're not going to stick with it and you're not going to do it. So there should be a component of, flexibility and balance work, as well as weight training and resistance training, as well as a little bit of cardio. Yes, we're not saying don't do cardio whatsoever. It's just our perimenopausal woman who can't shed the weight. What do? We default back to, I'm going to do more cardio and I'm going to eat less. All that does is puts more pressure on your cells, on your system, and it increases your inflammation that much more, and your body's just going to hold on to that weight and you're not going to shed it. And then after that is your stress management that we discussed earlier. Stress management in the mind. It controls everything. So if the mind isn't calm, your body is the cortisol levels are going to rise, which then leads to inflammation, and we start the cycle all over again. And then at the end of all this is hormonal manipulation, right? Hormones are only going to work if everything else is in place. If all of the other pillars aren't optimized, the hormones aren't really going to do what they need to do. And this is where I really set expectations with my patients. It's that it's going to be slow. You're not going to feel amazing. It's not a magic bullet where it's going to fix everything overnight. We need to work together. And within weeks, you're going to see some symptoms improve. But the bigger picture, it's going to take some more time and maybe dose adjustments. So we need to really put it all together and, make sure women understand, hey, it's not just one thing or the other. We need to work through all of this together and get them to be their best optimized self.
When patients come into your office, what are they coming in with the most?
Depending on where they are. So in the early perimenopause component, it's more, mood, irritability, rage, where they're just upset with people and they don't understand why. It's out of character for them.
I call them my murderous days, pre-period.
Yeah. And they can now track it. And they're like, the 2-3 days before, I kind of hide away from everybody so I don't do something that I'm going to regret. The bigger part is also having the partner understand these changes, the husband, the partner, whoever you're with, your family, because it impacts them. You may not notice it because we're in our own world trying to cope, but it does impact everybody around you. And so them understanding that this is a normal hormonal shift, that it will improve, and that there are things we can do to make things better really helps the family unit kind of work together to, get through this. Because women were not meant to do this in silo, like individually. You need that community around you to help guide you so you don't feel so alone. Because for so long, we've been told, it's fine, just get over it, you'll be all right, and don't talk about it. It was taboo. It was shameful to even mention it. And a lot of women will tell me, I asked my mom about it and what her menopause journey was like, and she said, I didn't have anything. And they kind of like shut it down. Okay. So those things need to be addressed. And the other thing I get some women is, changes in their libido, their intimacy with their partner. They're like, I'm still attracted to my husband, but I don't feel like being intimate anymore. And if I wasn't intimate for the rest of my life, I'd be okay with that too, which again is a bigger conversation. And that's a very, red flag for me, because in our world and for women, intimacy, it is a sense of well-being. So it all needs to be addressed together.
So there's a lot of symptoms we've talked through. What about women who might come in and not have any symptoms? How might you know that they're in perimenopause or not?
And so there are women who, are lucky and their perimenopause and menopause journey is quite, under the radar, basically. And the way they'll know that they're going through it is really the cycle changes. Like they just will either not get periods for a few months and then they'll get them back, or they'll come and be like, oh yeah, I haven't had a period in a long time. And when you look, it's been a year. And then you say, okay, well, you're postmenopausal now. Others, I think it's also how they handle things. Some women are just more stoic and they handle stress and things like that much better. And so they're not chalking it up to perimenopause or menopause. At the end of the day, it's not just about symptom management, as we spoke earlier. It's really more about disease prevention down the road. Will everybody sign on to it? Probably not. Will everybody need it? Probably not. But it needs to be part of the conversation. There's a category of women who will never be candidates for hormone therapy. Somebody with active breast cancer, somebody with a history of breast cancer personally, not a family history, but a personal. Somebody who has a clotting disorder may not be a candidate for certain forms of the hormone, but there are others that she can take. Or if there's unexplained bleeding, that individual we need to rule out before we can put her on any medication. And if they're over 60, what if they have underlying cardiac disease? Then that individual may not be a candidate. But most women generally are candidates unless there's something else going on.
And would you say that most women have some symptoms rather than not? I know that my experience was kind of exploring it and wanting to educate about it. And then when I scratched the surface, I was like, oh, I do have all those symptoms.
Yeah. I think, again, we downplay things so much because that's just in our nature, that when I've had patients tell me, no, everything's fine. They're there for their annual checkup. Oh, I'm great. Everything's good. Yes, I'm just here for my checkup, doc. Okay, fine. Then I start inquiring a little bit more just to kind of make sure we're not missing anything. Are you sleeping well? Well, no, I don't sleep well. I get I wake up at 3:00 in the morning every night and I don't really know why. Okay. And my radar goes up. I'm like, okay. And how about your mood? Oh no, my husband, I think, says I'm really moody. And are you intimate with your husband? No, I mean, I love him. Nothing's wrong. Everything's fine, but I just don't feel like it. What about vaginal dryness? Oh yeah, that too. But I just thought it was part of getting older. So again, Some people really have nothing, which I think that's kind of rare.
Mm-hmm.
I think most have some symptoms that they're just not putting together and not piecing it together. And if you spend the time to inquire, you can show them in black and white, actually, you're there. And that's where, the light bulb, the aha moment happens. And they're like, well, what do I do about it now? And that's where we can start having the bigger conversations.
So there are many women in the Flow Secret chats submitting their symptoms. And so I want to do a quick rapid fire round going through some of the symptoms we hear about there. I want a peri yes or a peri no if these symptoms are part of perimenopause.
Mm-hmm.
Okay. Burning mouth syndrome.
Peri yes.
Blurred vision.
Peri yes.
Numb hands.
Peri yes.
Wow. Itchy ears.
Peri yes.
And restless legs.
Peri yes. All the above.
Wow. Say more.
Yeah. So there are a lot of outlier symptoms, and any kind of skin or mucous membrane dryness can drive this. I have a story of a patient who wears contact lenses and was at a conference and was sitting by a fire pit. Something in that irritated her eyes, where she went to bed that night and woke up the next morning and couldn't open her eyes. She thought something bad had happened.
Wow.
Like she actually thought she was going blind. Fast forward, she goes to the ER, and it was extreme mucosal dryness of the eyes. And because of her contacts, it had kept everything together. So that's all it was. But again, imagine being so scared, something like that, thinking something bad has happened. So, it could be dryness of the mouth, tingling of the mouth. You could even have like changes to the tongue's texture, itchy ears. A lot of times we see this. A lot of joint aches. So the musculoskeletal syndrome of menopause is a real thing where joints start, because they all have joints and the ligaments and bone, they all have estrogen receptors on them. And if there's not enough estrogen around, you're going to start having some issues. So it's little things like that. Not that I'm saying everything is due to perimenopause and menopause and estrogen, but there is an underlying factor. So you really need to be aware and look into it, because not everything is about hot flashes or rain fog or mood changes or, not sleeping. There are other components, and these are some of those outlying symptoms that we see sometimes.
Thank you so much for the itchy ear. That's something that happens to me. It's so wild.
Mm-hmm.
And that's also part like why I love putting Flow in perimenopause mode, because it gives me a chance to track all those little things that I had no idea.
Mm-hmm.
And it's not just the tracking, it's the going into the app, seeing them on the list and being like, oh, I had no idea that was a perimenopause symptom.
Yeah. Some other ones are the recurrent UTIs, right? Where you weren't getting any kind of vaginal infections or any kind of, infection whatsoever. And all of a sudden now, every month, you're going to the doctor or to urgent care and you're being treated for a urinary tract infection. And nobody can explain why until you're on your 6th dose of antibiotics and you're like, what's going on here? So that is a component of atrophy that's related to lack of estrogen. And so, we lose that barrier there. And so you get more infections. Intimacy becomes painful, right? And then that can lead to even, lower libido. So is the libido due to desire being a problem? Or is it because there's pain with intimacy? Or is it all of the above? So that whole conversation is also something to delve into as well, is because it affects more women than we know, because again, we don't discuss these things openly until now.
I'm going to start having perimenopause dinner parties and just being like, right, everyone put your symptoms in the mix. Let's see what it is.
Yeah. And you're going to find things that, you may have not heard about before, but 9 out of 10 times, it's probably going to be a hormonal situation that's causing it.
Wow. Okay. So we're hearing from so many people that they go to the doctor. They're told that their labs and their bloods and everything look normal, but they're still feeling all these things. So what should we do in those situations?
What gives?
Yeah.
What do we do here? Yeah. I don't like that word normal. There's okay. The normal range is just a range that the lab gives us, right? So you could be on the lower end of that normal range, or you could be in the middle, or you could be at the upper. So I like the word optimal, which we know there are optimal ranges for certain things, which is this is where your body at this level will be working its best and most efficiently. So that's really where it's at. A lot of things can look normal, but if you're not feeling well, there's more to do. And so women need to walk in, demand better. And if it's not provided, that's okay. You say, thank you so much for your time. And you find somebody else who will sit down and give you the time you deserve and the answers that you're searching, because there's always something to do. And even if there isn't, they can at least explain the why behind it. But just to say it's normal, move on, isn't an appropriate answer in this day and age.
I've had that exact same experience with like a general doctor and even fertility doctors. And I just totally agree. Like going to see a specialist in this season of life that you're in, it makes a world of difference.
100%.
How difficult is it for our doctors to even really tell what's going on here? So there's a lot of things. I had this experience myself. Let's just put you on an antidepressant. Let's put you back on birth control. It kind of gets covered up as anxiety or depression or different things. Tell us why that might happen.
I think it's old school way of thinking, where we're just kind of trying to control down the ovarian malfunction that's happening to cover the symptoms. And it may work for a little bit, but again, it may not be the right answer. If a woman is perimenopausal and she's in her early mid-40s and she needs a form of contraception, maybe the birth control pill is appropriate and she's having symptoms. That would be a part of the conversation. But if we're past conception and we're not worried about that and they have permanent sterilization, then the birth control pill is not an appropriate option at this juncture. Number one, dose is too much. Number two, it's synthetic. So this is where we need to be able to say, okay, we're going to make a transition to bioidentical hormones to help with your symptoms and help you going forward to feel better. But the birth control pill is only going to do so much, and then her symptoms are going to exaggerate as she gets through the perimenopause transition.
Do you think that women have a gut instinct that we really are the ones to know our bodies best?
That's what I try and explain to my patients all the time. It's like, listen, you know yourself better than anyone else. And now with all of this information, all this education out there, I'm hoping you can take that and tune in even more. And if it doesn't walk like a duck and doesn't quack like a duck, go elsewhere, because you know what you know. And we don't. I'm a doctor and I only see my patients, let's say, twice, 3 times a year. But if they tell me, doc, something's off, I don't feel right, I trust them because they're living with it. They know, hey, this dose was too much. This dose felt better. Okay. It's a conversation to be had, but no one knows you better than yourself. And that's kind of why we always talk about be in charge of your own body, right? And educate yourself so you can advocate better for yourself. No one's going to do that for you. You cannot expect to walk in and be like, I don't know what's going on, so help me. We need to have a working plan together. And that's where you're going to get the biggest, benefit from your time and from your care.
And even more reason to have the symptoms and the tracking in between the 2 or 3 times a year that you get to see them. That data set is so valuable.
It only helps coordinate their care that much better and wastes less time from when they're feeling terrible to when they're actually better and getting that treatment. So if they have the symptom tracker and they come in and they show it to me, I'm like, great, we have it. Right. We're going to start today rather than now go home, track the symptoms, now come back, because you need at least a month, maybe 2. So as long as all of that's there, it just makes your visit that much more fruitful for you and you get the medication that you need.
I have been checking out the perimenopause relief options in the Flow app, and it shows you what's out there so you can have a better conversation with your doctor, as we were just saying. So let's go through some of them. Can I say some of the lists of all of my perimenopause and my score and kind of go through that with you? Okay. My perimenopause score is 53, up from 50 only a month ago. What does that tell you?
It tells me, remember, the hormonal fluctuations that are happening, they're not only on a day-to-day basis, but they're on a month-to-month situation. So back to stories, I guinea pigged myself. So when I was going through my perimenopausal changes, I was in denial. And so 1 month I would do my blood work and everything was perfect. The next month I would do it and my levels would be elevated. Then the next month I would do it and the levels would be normal. I'm like, see, I'm not in menopause. I'm not in perimenopause. I'm fine. But again, it can fluctuate from day to day to day. And so your score slightly going up, does it mean anything? Maybe, maybe not. The body, I feel it's giving us little signals. It's up upon us to kind of tune into the signal and decide, okay, what am I going to do with this? And is it something bigger that I need to address?
That's my inkling on why the score went up, because I've learned so much in the last month. And the way that I'm tracking and paying attention and tuning in is completely different. I've had so many light bulb moments in this conversation where I'm like, oh, maybe that's what's going on for me. Yeah. So the more you can educate yourself, the more kind of tuning in that you can even do, and the awareness gets built. Let's talk about medication now. What are some of the most common medications that really help?
The thing is, there's so many categories of medications, and I don't want women to walk away thinking, okay, I need a medication, right? A lot of symptoms can be managed, as we spoke earlier, with lifestyle modifications and implementation. Then you go to where are you in the journey and what is impacting you, right? If it is something more with hot flashes and things like that and sleep, we have non-hormonal options for that now. So you don't necessarily need to jump on HRT right away. If it's a few things, you can use the medications that are non-hormonal, like Linqued and Veoza, and they help with sleep. They help with hot flashes, and you're good to go. Now, where does HRT come into play? And that is based on the individual. The conversation should be, where are we in the journey? How are the symptoms? Is it impacting your quality of life? And if the answers are yes, then this is a conversation and this is an option. And we have multiple different varieties of hormone therapy. We have estradiol, which can be given via a vaginal ring. It could be a patch. It could be a gel. It can be mist. And there's the pill. In terms of the progesterone, there's oral micronized progesterone, which again, everything keeps shifting and changing. It used to be if you had a uterus, you needed the progesterone to go along with it to protect the lining of the uterus from overgrowth, from the estrogen stimulation, to avoid any kind of uterine cancer, God forbid. Now we know progesterone has other benefits besides just uterine lining protection. It helps with cognition. It helps with calming down anxiety and sleep. So it's like the calming medication side of hormones. And so we're using it in both women with a uterus and without a uterus. And then we always forget about testosterone. Women make testosterone. We've made it all along. We don't make as much as men. We don't need as much. But our bodies run on testosterone as well. And testosterone has only been looked upon in women for libido. And it plays a much bigger role than just libido. It's for muscle mass maintenance. It's for skin tone. It's for cognition. And again, overall well-being. These three hormones, estrogen, progesterone, testosterone, work hand in hand together to make an individual feel like themselves again. So you shouldn't really just give one or the other. It should be depending on the individual. I have some who are really, they've hit the wall. They're not, and they want everything right then and there. And I have others who we layer. So we start with the estrogen and the progesterone, then we layer on the testosterone. But this is the way each individual needs to be addressed. It's precision, individualized care, depending on who's sitting across from me. But I want women to understand there are options and that it's not one thing or the other. It's depending on where you are, what's bothering you, and what we can do to make it better.
How often do you recommend checking in with your doctor about those things? Because surely on that spectrum, that continuum, things change.
Yeah.
And especially with medications.
So if they're in their perimenopause era and the symptoms aren't that bad, I actually have them take the questionnaire home that I have so they have it in front of them so they don't forget. And if the symptoms start becoming more noticeable, I want them back. So if they have the Flow app, I'm like, keep checking in. And if it starts going up, I need you back in here. So that could be 2 months. It could be a year from now. Women who are on therapy, if I start them, I like them back in 8 to 10 weeks to check in with them to make sure they're tolerating it well, number one. Number two, are their symptoms improved? Because we need to make dose adjustments. Some people get it right off the bat. They're good. They're like, wow, I cannot believe it helped so much so quickly. I've had women tell me, I didn't realize how bad my symptoms were until now and where I was. And I thought that was just going to be my new norm.
I can think of 2 friends that story is exactly right.
Right? And how horrific could that be, where you think this is just the new way I'm going to be, and it is what it is, and you still have another 50 years to go. Versus others are like, oh my gosh, it's like, you know, in Wizard of Oz, where they're walking on the yellow brick road and it's in black and white, and all of a sudden everything's in color. They're like, I see in color now after being on these medications. So you really, it's, you know, again, very specific. Some, it takes me 6 months, sometimes a year to really get them. And then if I'm in perimenopause, in a year, they reset. I'm like, well, we got to start from scratch again. They're like, Doc, I was feeling so good. I thought I had a patient. She's funny. She goes, you know, I came to you and you fixed me, so I don't really need you anymore. I said, if that's how you feel, okay. 6 months later,
see you next year.
She's like, I'm back. What happened? I was like, you evolve, honey. Like, it's not one and done until you're in menopause, and that's different. But in this perimenopause journey, things change.
There's so many women that are still worried about taking HRT and the risk of breast cancer. So can we talk about that for a few minutes?
Sure. I think that just stems back to, you know, the data that came out of the research study of late 1999 and was published in 2002, the Women's Health Initiative study, which was a very well-intentioned study. But the thing with the study was they were looking at disease in older women. So there were a couple of different problems with the study. And so the you know, published news article that came out was that it was hormone replacement therapy was causing increased risk of breast cancer, stroke, and heart attacks. Now that's 2 generations, you know, 2 decades of women who were never treated. Ever since then, all of that research has been re-looked upon and republished. And we know that there were errors with the study. One of them being that the women in the study were a lot older than the women we're talking about now, that menopause is 51. They were looking at 60-year-olds who already had underlying conditions that could predispose them to those outcomes. Number 2, the kinds of hormones that were used in that study were synthetics. Premarin, Provera, not the bioidentical versions that are being used today. Okay. So those were all the, you know, the different things. And even the estrogen only arm of the study, where those women, they did great. They had no increased risk of breast cancer or anything, but we don't talk about that enough. So if a patient comes to me with these concerns, right, I ask them their family history. I ask them their personal history. Where does your risk status stand? And most of them are below the threshold.
So what if I don't want to take hormones? What else could I try? How else could I kind of shift my lifestyle in this phase?
Some women are not ready to make the jump, I call it. And we go over all of that. And to be frank, we need to really hone in on the lifestyle changes. Otherwise, like we discussed earlier, nothing else is really going to work and give you the impact that you need. So in terms of lifestyle, we spoke about sleep. We spoke about stress management and movement. The next part is nutrition. It really needs to be dialed in. And by that, what we're talking about is the amount of protein that you're getting. It's so critical for that bone and muscle mass preservation. What I tell patients to make it easy for them is 30 grams at each meal of high quality protein. So it's a protein component, it's fiber. 30 grams of fiber. You know, we throw out these numbers and you think it's easy. And then you go look at something and you're like, wait, that's got 4 grams of fiber? How am I going to get the other 26 grams in here? But if you really dive in and you bring in those cruciferous vegetables and broccoli and things like that, you can actually get it pretty darn quickly. It really shouldn't be coming out of a can. It should just be, if you have a farm to table where you're just getting it and using it in your food and eating it basically, and really staying away from alcohol. Now I have people who are like, I need that glass of wine every night. Okay, but it's going to impact your health and it's going to impact your sleep, which then is going to impact everything else. So none is better than none at all. Like not 1, not 2, 0. If you can do that. Again, it's not for everybody. And we want to make it a lifestyle habit where they're going to stay with it. So if I tell every patient, you can't do this and you can't, they're not going to be happy with that and they're not going to commit to it. So really it's a well-balanced overall diet that is going to help them feel better. Melatonin is out there. We have certain magnesiums that can help with sleep and energy throughout the day. Vitamin D3 and K2 for the bones. So really, that is how I present it to my patients. I don't give a list of a million supplements because you really can't out supplement your way out of bad diet. If you don't have the diet in place, no matter how many supplements you throw at it, it's not going to work. And so you need to really kind of tie it all in, make it palatable for them and make it easy to understand. And you will notice with time that the symptoms will improve until they're ready for the next phase. That's what I call it. I'm like, okay, so we're going to start here and then we'll see where we're at in 3 to 6 months and then add as we need.
So while we're talking about diet and nutrition, I know that perimenopausal weight gain is a major problem for people. Is that something that can be reversed?
It can be addressed well if we tune in to the diet that we spoke about, because most women tend to go to the opposite, which is calorie restriction. But you actually need to eat. You need to send those signals to your cells that to work and to do what it needs to do. As long as we know there's not an inflammatory component and an insulin resistance component going on, an appropriate, well-balanced diet can actually help you reverse the weight gain that's happened. And it can also, impact how you feel overall as well. So yes, absolutely.
All right. We're coming to the end of our chat now. Thank you so much for everything. I've learned so much. What would you tell a 39-year-old woman like me who's on the edge of this next phase of life?
I would tell you to buckle in, pay attention to your body, and don't be afraid of what it's telling you. Okay? Tune in, use your app to write in all your symptoms and kind of see where you are and trend it out. And don't be afraid to ask for help sooner rather than later. But we don't want you hitting that wall. We don't want you to fall off that cliff of menopause and then have to pull you back in. We want to guide you through it gently so you can actually enjoy this next phase of your life, because this is really the next chapter and it holds a lot of potential. And that's where, we really can shine.
That's a beautiful ending point. We've talked a lot about the challenges of this, but let's spend just a minute or two talking about how this season can be so joyful and empowering.
I think a lot of us have gifts within ourselves that we just didn't know about and didn't really look inward to find. And for whatever reason it is, this next chapter is allowing a lot of women to dig in deeper and find those gifts, things that they would have never considered a decade prior. And now they're at this point in their life where they're like, you know what? I'm not the same 49, 50-year-old that my mother's generation was. It's a different ball game. We're more professional. We're at the peak of our professions for a lot of us. And our children are older and they're out of the house. And there are other things going on that are driving us forward. And so it's really exciting to kind of look at it and be like, I don't really know what it's going to look like down there, but I'm going to give it a shot and I'm going to keep going with it. So I want women to kind of tune into that because I have met a lot of women along this journey the past, I don't know how many years, where their stories are really exciting, where they were one place and now they're completely in an opposite place and thriving. And that's, I think, the takeaway for every woman is they have that within themselves.
That's so beautiful. Thank you so much for this conversation and your time.
Thank you for having me.